And Breakfast Extra continues, but this time with Wellness Central, is where we delve or dive into important health topics that affect everyday life. And today we're focusing on one issue that affects pretty much a lot of people. It's diabetes, and it's an ailment that has become a global health concern. Diabetes, particularly type 2, is on the rise, and understanding its causes, symptoms, and preventive measures is critical. It affects millions of people worldwide and is often misunderstood or left undiagnosed, leading to more severe complications. And so in today's discussion, we'll break down the essential facts about diabetes, from its underlying causes, such as genetics, lifestyle factors, and diet, and also to the key symptoms you should be aware of, including excessive thirst, fatigue, and weight loss. And we'll also, and weight loss. We'll also explore how timely diagnosis and proper management can significantly improve quality of life for those living with the condition.
And so joining us today is Dr. Yusuf Haroun, a seasoned medical doctor and founder of Love for Health organization, who will be shedding light on diabetes, offering tips on prevention and discussing more best practices for managing the condition. Dr. Yusuf, good to have you here in studio this time. Yay.
Thank you.
Thank you.
Welcome. How are you doing?
I'm doing good, and you?
Well, we're fine. Thank you for asking. Not many people ask us how we're doing.
I always say I'm doing though.
Well, let's talk about diabetes now. There's many kinds of diabetes. So which one exactly should we be very wary of? If you can differentiate all the different types for us.
Yeah, thank you very much for this very important question. Firstly, there are two main types of diabetes. You have the type 1 diabetes, and as you introduced, the type 2 diabetes is the most common. We also call type 1 diabetes insulin-dependent diabetes. It's because you usually treat it using the insulin injection, and majority of people who have it, or most people, are those who are in their young age.
Right.
Type 2 diabetes is commoner. It is called non-insulin dependent. However, some people with type 2 diabetes don't get proper treatment with their medications like glucophage, metformin, or all other anti-diabetic drugs. They have to resort into the insulin. So there are two main types of diabetes: type 1 diabetes and type 2 diabetes. Thank you.
Right. Now, I mean, you just talked about the most common, you've talked about the types of it, right? Let's talk about the most common causes of diabetes, right? Particularly type 2, like you said. Is it purely genetics, or can, lifestyle factors like diet, and exercise play a role?
Absolutely. Both of what you've said are also one of the commonest causes of diabetes. So genetics can be a cause. We call hereditary. Hereditary is one of the greatest risk factor, meaning if your parents have diabetes, then you have to be on the look. You can also develop diabetes. Then lifestyle also matters, because why is diabetes on the rise today? It's because of people's lifestyle. We consume lots of sugar, alcohol, smoking, sedentary lifestyle, as you talked about, no exercise. All this, obesity is also another risk factor. So we have multiple risk factors of diabetes.
We were talking about whether or not it was purely genetics, and you were saying yes, as well as lifestyle can play into that, and diet plus a sedentary life. Please continue.
So it's a combination of both lifestyle and hereditary. So these two usually result or usually cumulate to determine if someone is going to become diabetic. Now, one important factor to know, because everybody has sugar in their blood. So is everybody diabetic? No. But when the blood sugar, especially the fasting blood sugar, is above 126 milligram per dl or 7 millimoles per liter, then that person is being diagnosed of being diabetic.
Could I be diabetic and not know?
Absolutely.
Yes,
according to a meta-analysis, about 11 million Nigerians are undiagnosed for diabetes. That means out of a population of average of 200 million Nigerians walking on the streets, 11 million of them
significant amount,
have
like
diabetes.
0.5% of people.
Exactly, they have, that's it. And the funny thing is that many of them get to be diagnosed when they start developing complications of diabetes.
So what are the early signs one ought to know?
Thank you. While you were introducing diabetes, you talked about excessive thirst, weight loss. These are some of the early signs. We call something 3P in medicine: polydipsia, that is excessive thirst. Someone keeps drinking water all the time. Polyuria, excessive
don't look at me
urination.
do this. I just put down my
He was about to pick up, like, can you hear excessive? Please drop the cup down. Please continue.
So, no, drinking water is very good. Hydration is absolutely good. But when the person gets excessively thirsty, dehydrated, that could be a symptom, an early symptom of diabetes. Polydipsia, that's it. Polyphagia, excessive hunger. The person keeps getting hungry. And in addition to what you said, weight loss. Sorry, the person is eating a lot, but the person is still losing weight.
Oh.
So polydipsia, polyphagia, and polyuria, excessive urination. Person is waking up 3, 4, 5 times in the night to go to the restroom. So these are part of the early...
Yeah.
Oh, that's very interesting. I wanted to know, Doctor, now, there is sugar present in the blood, and it should be so.
Absolutely.
So diabetes is the presence of excess sugar, am I
Beautiful. Correct.
Now, the sugar gets in there by consuming sugar, or what exactly? Let's be clear.
Thank you for this very important question. People think, oh, physical sugar you consume is what causes diabetes. No, that's not what causes diabetes. Someone can take in sugar. If your insulin, which is going to convert this glucose to glycogen, is very, very good, it's going to work. Everybody consumes sugar. Some of our food are being converted into sugar in one way or the other. But when you have excessive sugar, that is when the blood sugar is above 126 milligram per DL, another opposite for diabetes or hyperglycemia, diabetes is also known as hyperglycemia. Hyper means high blood sugar, is hypoglycemia. That could even be worse. Hypoglycemia is when the blood sugar is very low to the extent that the person can go into shock or coma. The person becomes very weak.
Right, and let's just be clear, because when somebody hears sugar, they think the actual sugar. So let's be clear, if it's just white sugar, brown sugar, sugary food, junk food, or
carbon,
carbohydrates,
now,
and even liquid alcohol.
Now we just say sugar. We say sugar for people to understand, but actually it is glucose.
Glucose.
Glucose is the actual blood glucose is what we test in the blood in diabetes. So when the fasting blood sugar is beyond normal, even in the home we can use glucometers. Strips which you prick your finger, and once you see that the blood sugar is high, you can suspect. But it's on 2 separate occasions. But in medically, we usually use or confirm through glycosylated hemoglobin. So that's the A1C. If that is also above 7, then that means the person, on 2 separate occasions, that means the person is being diagnosed of diabetes.
So I'm still very concerned about what kind of foods or what do we ingest that could raise or drop the blood sugar level.
Now, carbohydrates also have a factor, but not only carbohydrates, even fatty foods, smoking, excessive consumption of alcohol, all this can also raise the blood sugar in the system.
Now, how does smoking raise the blood sugar? Because you're not ingesting carbohydrates like Judith suggested before. It's just an action of inhaling and exhaling, well, nicotine, I guess.
Okay. Now, there's something called Syndrome X. It's a more complex medical system where smoking itself can also increase the cholesterol. Smoking has a whole lot of complications. It can cause erectile dysfunction, like I talked about previously. It can increase the cholesterol. It can increase the blood sugar. It's a complicated system. Alcohol also can do the same. That's why I said it's not directly sugar in the blood, but there are some complications that can increase the blood sugar in the system. Smoking is one of it, alcohol is one of it, sedentary lifestyle is one of it, hereditary is another one, and there are multiple risk factors like that that can cause diabetes.
So, how crucial then is our diet in managing,
Absolutely
how crucial
beautiful.
is it? Are there specific food one should be looking at in their diet? And how particularly beneficial are these food, whether,
Your
vegetables?
lifestyle is almost 99% of, there's a common saying, you are what you eat. And your lifestyle, particularly your diet intake, is a significant importance to your health, particularly either you being diabetes, hypertensive, obesity, or anything. So diet is very crucial. Most especially, we should increase in green vegetables. We should eat lots of vegetables. We should drink lots of water, but we shouldn't be scared of diabetes like polydipsia, as I said. But we should eat lots of vegetables. We should work out. We should do lots of exercise. We should eat more beans, proteins, animal proteins, plant proteins, vegetables. Olive oil is very good also. Okay. So all these can also increase. Grains, they are also good. But the best advice I'll give everyone is moderation in all what you do. Moderation
is very important when you think about it, because even I think when people go on caloric deficit in their diet, what they're trying to look for is a moderation in their portions. And that's the thing about it. We will go and meet we'll go to our local restaurant or buka, and then we ask for the portions that we, and even at home, the heaps of the fufu and eba that you are eating.
No, Judith, listen, this is Nigeria. Anytime you have the chance to eat heaps of ito. I'm joking for your health. Be very
Just be mindful, yeah.
I'm very curious regarding the stats that you gave from before about 11 million Nigerians being undiagnosed. Now, do you see a cultural connection between our diabetic population and the prevalence?
Just like the erectile dysfunction I discussed 2 weeks ago, like there's a cultural perception. People think, oh, a man has erectile dysfunction, maybe it's village people or something. The same thing in our mothers and grandmothers or grandfathers' days. They have what they call, in Yoruba, they call egbotioji, like they just develop a sore on their foot which doesn't heal. That is one of the main complications of diabetes. It's called DMFS, diabetic mellitus foot syndrome.
And always the foot?
It's not only the foot. There's called diabetic retinopathy. One eye or both eyes go blind.
Oh, wow.
There's also what you call diabetic nephropathy. The kidney also shuts down. They need dialysis. It could also even develop into stroke, diabetic stroke. They could have erectile dysfunction, like in men.
It manifests in very different ways.
Now, diabetes and hypertension are twin diseases that are silent killers. Till the person might develop these late complications, which they might think they are village people are pursuing them, not knowing it's their own medical condition. It's towards the end. It wouldn't give you any warning sign sometimes until it gets worse.
Is it incurable?
Now, diabetes is manageable. Being curable means like you cure it completely, like you cure malaria from the blood system, or you treat plasmodium in the blood when you have malaria. Diabetes, on the other hand, is manageable. You unfortunately have to continue managing it for life. You may not have to use drugs all the time if the blood sugar is normal, but you may have to modify your lifestyle all the time.
And let's talk about treatment, besides just manageable and, all of that.
Change of habits.
Or change of habits, treatments especially. Advancement, have there been advancement in treatments as well? The cost of it and the most effective way to treat it, I know it's a lifelong thing, isn't it?
Yes, in the United States, an advanced country, they are looking at different methods of treating diabetes, just like they are looking at different methods of treating HIV. Some are going into genetics, going into bone marrow replacement, going into blood studies, hematology. So they are looking for more advanced ways to treat diabetes. But in our society, in Nigeria, our consultants and professors, the basic way they use in treating is still lifestyle modification, advising the patient to modify their lifestyle, to avoid fatty foods, avoid excessive carbohydrates, to exercise, to improve their lifestyle, and they then place them on medications. You have a wide range of medications from metformin, glimepiride, glycoside, glucophage. There are different anti-diabetic drugs. Now, if the diabetic drugs don't work, they resort into another line of action, which is insulin. In insulin, you have different kinds of insulin also that you can give patients. There's a long-acting, there's a short-acting, there are ones they give. Even many patients know how to administer this insulin by themselves. In advanced countries, and I believe some people also have it, there is something like a device on the arm. So you would know, or the patient would know, when he or she is having hypoglycemia or hyperglycemia. Because another problem with diabetic patients is when they take excessive drugs or they treat themselves, they might even go into hypo. And I said, hypoglycemia could even be worse.
So what do you think about, what is your opinion on this introduction? I don't know the name of the drugs, Ozempic and, all these other weight management. I think they were supposed to be sold for people who are obese, right? And then now it's not being used by Hollywood to maintain it. So it's a whole different conversation. But what do you make of drugs like this?
Yeah.
And what are their real names, Ed? I know there's a
Yes.
name for it.
Now, some drugs are used to treat cholesterol. So they have the statins, the basic ones, they are called like simvastatins, statins, just like in diabetes also. So remember I also said there is a correlation between diabetes and obesity. So some of them use these drugs, but I will advise everyone to get prescription for using any drugs. Because they can use some of these drugs and they could go into adverse effects. So all these drugs you mentioned are used by some people to lose weight. Sometimes they are prescribed by medical doctors also to reduce the cholesterol level, because many people with diabetes have hypertension and have high cholesterol.
Yes.
Yes. Now, affordability in managing diabetes, it can be expensive, can't it?
In this economy.
If it is so expensive, what alternatives are there?
This is why some of us in the diaspora coming back, we are looking for having a health organization where we can work with the government. When I was in Lagos State Teaching Hospital about 20 years ago, there was a young girl. As I said, young people have type 1 diabetes and they need insulin. Yes. This girl passed away just because of insulin. And then insulin was maybe just 1,000 or 2,000 naira. Then now it may be even 100,000 just for insulin. So she died because of the cost of the insulin. No, they could not afford even 1,000 or 2,000 naira. She passed away. She had hyperglycemia, went into coma. Diabetes is very complex. You can also go into diabetic coma, DKA, diabetic coma. Yes, you go into diabetic coma, and that could also be another problem. So in some countries, Saudi Arabia, where I practiced before I went to US, health is 100% free. Qatar, Dubai, Kuwait, Canada, health is free. So someone with diabetes walks to the hospital, gets free treatment, free surgery.
And on alternatives, are there herbs or local practices that could aid?
Over there, the Chinese have been trying to sell their drugs. One thing the US does is FDA just approves if it is not going to be harmful or toxic to the body. So it is approved under food, just like our regular.
All right, so the tax exemption is off it and it's more cheaper.
Yes, they give them food. So all these herbs you talked about, I don't have any problem with herbs as long as they are well regulated.
Okay, interesting.
Well, Doctor, I must say thank you,
for
Dr.
coming
Yusuf. on. It's been quite an informative session today, and just understanding the causes, the treatment, and just lifestyle management when it comes to diabetes, and also the type 1 and type 2. Once again, thank you.